My name is G. Hatfield, and I'm the CNO for HealthLeaders, and I will serve as your moderator for this session. Today's webinar is titled The Winning Edge for Recruiting the Best Nurses and is sponsored by CareRev. Thank you so much to our sponsor and to you in our audience for participating. Before we get started, for those of you participating in the live program, I have a few housekeeping details. Our program will be approximately 60 minutes in length. Note that an on-demand version of this program will be available on our YouTube channel on Friday and can be accessed through our website, healthleadersmedia.com. To ensure that you can see all of the content for the event, please maximize your event window and be sure to adjust your computer volume settings and/or PC speakers for optimal sound quality. Next, you will find a resources list for today's webinar on the upper right hand of your screen. Here we have listed the webinar slide deck for you to download along with supplemental resources. Additionally, you will find a registration link for the future The Winning Edge events. At the bottom of your console are multiple widgets that you can use. To submit a question, click on the Q&A widget. It may be open already and appear on the left side of your screen. You may submit questions at any time during the presentation. However, please note that it is likely that your questions will not be answered until the Q&A portion of the program. And finally, should you experience any technical difficulties during today's program and need assistance, please click on the Help widget, which has a question mark icon and covers common technical issues. At this time, it is my pleasure to introduce our panelists. First, we have Larry Adams, who is the Chief Nursing Executive and Senior Vice President of Strategy at CareRev. We have Jess Almeida, who is the Chief Nursing Officer at Cedars, Sinai, Marina Del Rey Hospital. And finally, Gail Vozzella, who is the Senior Vice President and Chief Nurse Executive at Houston Methodist. Thank you all for joining us. And with that, let's get into our discussion. Thank you so much to the panelists for being here. And right out the gate, can you each tell me a little bit more about yourselves and your organization? If Gail, you want to get us started.
Sure. Thank you, G, for having us today. It's such a great topic. I'm Gail Vozzella. I'm the Chief Nurse Executive at Houston Methodist in, of course, Houston, Texas. And I am part of a 7, soon to be 8, with our 8 being a high-tech hospital that's soon to open in March. And we are in the medical center of Houston, Texas, as well as the surrounding communities, hoping to serve patients in the Houston area. And we are an adult quaternary care hospital system.
Awesome. And then Jess, what about you?
Hi, I'm Jess Almeida. I'm the CNO at Cedars Sinai Marina Hospital. We are part of the Cedars Sinai Health System, which is actually international, and we are in Los Angeles area. So we actually are a smaller facility. We right now are in a community hospital that we refer to as our vintage building, because it's very vintage and very cute, but we are in the process of building a brand new facility right outside our back door. So we're very excited about that.
Awesome. And then Larry, what about you?
Cool. Hey, G, Gail, and Jess, thanks for having us. So I'm Larry Adams. I've been a registered nurse for over 25 years. I've worked as a travel nurse across the country in a lot of the neurotrauma units, so experience firsthand about the topic we're going to be speaking to. I've also worked at AMN as well as been in the technology per diem space for about the past 2.5 years now. And as G said, currently serving as the Chief Nurse Executive as well as the SVP of Strategy here at CareRev. And for those that may not be familiar with CareRev, we're a technology platform that's transforming how healthcare facilities connect with clinical talent and management of your internal float pools. So thanks.
Absolutely. Well, thank you, all of you, so much for being here. Today, we are here to talk about recruitment. So right now in the United States, the Bureau of Labor Statistics expects the number of registered nurses to grow by 6% before 2020 or before 2033. And according to the Health Resources and Service Administration workforce projections, between 2025 and 2037, the demand for registered nurses is going to continue to outpace the supply, which is that nursing shortage that everyone is always talking about. So my first question for you today is, what are some of the biggest roadblocks that stand in the way of recruiting new nurses? If Gail, you want to get us started.
Sure. So I would say, first off, is you have to have an entire package for nurses as they come is that you can't just focus on recruitment. So because at the same time we're recruiting nurses out of nursing schools, we have a large number of nurses that are entering retirement. So that means, preceptors orientation needs more intention behind it to make sure people launching their career is done in the right way, that they want to be a nurse, not just for the short term, but for the long term. So recruitment to me is always paired with retention. You can't separate them. And so I think part of the recruitment roadblocks is people in nursing school spending less time potentially in clinical environments. So knowing where they want to start their career and then surrounding them with all the right components to make sure that that first year goes incredibly well, which means we have the right pay for those nurses, that they don't start off running short of pay and benefits is really critical. We also want the right work environment so that they are paired appropriately. Their assignment is appropriate. They have the right workload as they start to gain skills. That recruiters in recruitment doesn't lose touch with them from the time they start interviewing all the way till they start their first day. So that it can be a struggle. So people don't feel that they're dropped or that we don't care about them now that we've hired them. We want that touch to go through the entire process. And then the right education. So we all know as nurses and as nursing leaders, that transition to practice, we haven't got the secret sauce to that yet, to make sure that as nurses leave a didactic environment and start clinical practice, that it all goes smoothly. It is very stressful time in a nurse's career. And if we don't hit that right, then we have invested in somebody and then lost them in that first year. And that doesn't just impact us, that impacts that individual nurse. So people don't go into nursing school lightly. They go in to help people. They want to help. And so we have to make sure that if they struggle or if they're trip ups, that we surround them with the right people in order that they stay with us. And I think all of that whole recruitment to me is all the way from recruitment through that first year. If we hit that right, then we've done everybody a service to make sure that we have a sturdy workforce.
Absolutely. Great points. Larry, what are your thoughts?
No, I mean, Gail, I totally agree with you. I think it starts on why did we all enter the industry of nursing, right? We all have some reason that we are here and we were called to this great profession that we all do. And G, also to your point about the nursing shortage, is there going to be one? I think we can all agree upon that one. But I think what we have to double down on is how do we provide flexibility and how do we make nursing more appealable to the options that the nurses can work outside of the traditional 12-hour shifts every other weekend, some of those things that we're traditioned to, and all those I see are roadblocks to recruiting new nurses. We have to make it more attractive to them, but then we also have to make it more attractive to the individuals that are retiring to have them a bridge where they can still work 1 or 2 days a week or whatever their schedule allows them, because I firmly believe that nurses are craving flexibility. They want to be in the nursing profession, and we just have to do a better job at recruiting, retaining, and making sure that we have an adaptable on-demand workforce that these individuals will come and work for you.
Mm-hmm. Absolutely. And Jess, what do you think?
I agree with both Larry and Gail. And I would say even really organizations should look at the ease of an application. Nothing will turn you off faster if you're not paying attention to your technology and it doesn't work. If you don't know where your status is with an application, in multiple organizations I've worked in, you apply, you go through the steps, and everything's online these days, but did I get everything? Is it happening? Is anybody getting back to me? that can make somebody very quickly veer off to another organization that's a little more efficient, or maybe it's a little more user-friendly platform. And to Larry's point, I agree. We're all getting older in our careers, and we have to think from day one with nurses coming into the work field now. They're not coming straight out of college and high school. They're all various backgrounds and ages, and this is a second career. We have to have flexibility and options that still support our patient needs and give that work-life balance and keep people engaged and interested in the nursing field.
Mm-hmm. Absolutely. To your point, we have I think 5 generations in the workforce right now. So, recruitment and retention does not just apply to new grads, as you're saying. So speaking of new grads, obviously Gen Z is our newest addition to the workforce. And right now only about 6% of the nursing workforce is Gen Z, but that number is expected to grow quite a bit, obviously. And as a generation, they value things like social justice, equity and inclusion, work-life balance, and having a strong sense of purpose and connection to the work that they do, in addition to higher expectations about technology and flexible scheduling, as all of you have mentioned. So how has Gen Z and their kind of new expectations impacted recruitment strategies for CNOs? If Jess, you want to get us started?
Sure. I feel very fortunate that I have a little bit of Gen Z insight. I have one at home. Mm-hmm. And she had a lot of opinions and thoughts of this. And her first statement to me was like, Mom, we need to think of a job versus a career. It is not the same to us. Just going to a job is not the same. So healthcare to most of us is a career. Nursing is a career. And how do we really translate that to Gen Z of what is a job versus a career? What is I am coming in, clocking in and going home and getting my job done, which she has because she's in college currently. She doesn't think of it the same. She's like, when I'm looking for my career, that's where my reputation begins. And that's where I'm looking at the culture and the reputation of the places I might consider going to work for. I think sometimes we forget when we're interviewing that they're interviewing us as well, and looking at, is this the right fit for me as an individual? Are there other individuals there like me? And what does the whole package have to offer, to Gail's point, from the moment you click apply all the way through that first year? How is it going for them? She did also mention community outreach. She's very interested in the organizations that are involved in community outreach and social justice, and what is their engagement and their stance on that. And I think a lot of organizations really, I hate to say pick a side, but we need to share where we stand on those situations. We're in a very interesting time in politics across the world, really. And it's the next generation's paying attention to where our alliances are and how that will impact them in the future.
Absolutely. Larry, what are your thoughts?
Yeah, Jess, I'm with you. I also have a Gen Z, and she's in nursing school. I'm not sure if your child is in nursing school, but
no.
I get a lot of insights from her. She's a great inspiration to me on all of these things, and she keeps me grounded. And I do feel like I have a little Gen Z in me just because of her, as well as some of my fellow coworkers as well, too. They keep me grounded with those. But I think what we have to put in perspective is Gen Zs are the first generation that really grew up with screen time at their fingertips. That's really what they know, and they use that to their ability to do all those things that you just mentioned. They want to research the organization. They want to see what the organization is doing from an outreach standpoint, but then also they want that work-life balance and be in control of their schedule and be in control of their environment, because that's what they're used to doing. That's how they were raised. That's how they were doing all these things. So we have to really change the way how we recruit Gen Zs, in my mind, and keep them. And that's how we have to do it through our workforce. My good friend, Caitlin Obrock over at SSM has done some great work there. And she and I've chatted about this. And she's doing a nurse influencer role at SSM. So she's working with them, she's recruiting them, and they're having nurse recruiters that are influencers, and they're decreasing that time to hire, just as you mentioned, because the Gen Zs like the immediate gratification. And if they can call, they can interview, and they say, hey, we want you within 3 to 5 days, that's their instant gratification. They're getting that, and they're having great success with that over at SSM through Caitlin's hard work.
Absolutely. That's fascinating. And later in this conversation, we're going to discuss social media and recruitment. So I will definitely be calling on you for that, Larry. Yeah. And then Gail, what are your thoughts?
Well, Jess and Larry, of course, are spot on. I would just add that it's a generation that is not afraid to speak up. So it's incumbent upon us to listen as they speak up. So the kind of things that we've tried to address here at Houston Methodist are things they do not want to be burnt out in their profession. So we need to listen, well, how do we do that? So offering wellness, mental health resources at their fingertips in a variety of ways, whether it's through, online or in person, gyms, and then, things while they're on their shift in order that they feel cared for during the time that they're at work. They are caring for others, and the complexity of care certainly is very high. And so us as nursing leaders need to make sure that we care for our workforce. And we have to show people that we're doing that, talk about it, that it's not a taboo to talk about. And then we have to say, okay, well, is what we're doing working? And really that involves more than a yearly employee opinion survey, which does help because that's anonymous, but also walking around, talking to our staff, seeing, do they feel like their environment helps support them? So I think that is a huge thing. And I think just as Jess mentioned, this generation in particular wants to be part of something greater than themselves. Mm-hmm. Now, that is something we should all nurture, and we should feel privileged to work alongside them. And I think that involves things like community outreach that happens through, we're a magnet organization here, through magnet volunteering. It can happen through volunteering, even with their colleagues and to do projects within the community that your hospital's in, because people love, in particular this generation, to get to know each other more than just at their shift, at their job. And then finally, I would say is, I believe nurses now have made it loud and clear that they want to get everything done during their shift. Mm-hmm. They don't want to come in extra on their day off for training, for education, to do whatever it is that we require at our hospital organizations. They want it to happen during their shift. So that means we have to organize how we do simulation, how we do training, that it's during the hours that they work, so they can then, on their off days, enjoy their off days and not think, oh, I have to go back in for 4 hours. That is done. And I think that's a good thing for nursing. We should care for patients, and then we should rest. And I think the things that this generation is showing us, I believe, will help equip us to be stronger.
Absolutely. And I wanted to mention something Jess said earlier about ease of application. Obviously, we're talking about a lot of different strategies here, and things to improve the overall nurse experience as they're entering the profession in a new health system. So my question for y'all is, what is the best way to kind of advertise that your health system is employing all these different strategies? Because I think, obviously it's great to have them, but unless people know about them, they're not going to be useful. It's the idea of you can lead a horse to water, So what are your thoughts on that, Larry, if you want to get us started?
Yeah, happy to. I think it goes to, you have to make it easy. So whatever you can do to put it in the palm of their hands, whatever they can do to snap a picture, send it in, to do it on their terms in their own environment, I think is there. But I think just full transparency. I think historically healthcare's kind of been, we're going to put up barriers, we're going to put up blocks and stuff. And we really haven't been that transparent when it comes to different ways that we're good at things and how we can shorten the national average of 85 days from, speak to someone to onboarding someone to get that down to 30 days or 15 days or whatever we can do. But it's how can we make it easy? How can we have the new generation as well as others entering the field have it ease at the palm of their hand and therefore just be very transparent from the credentialing process all the way through the hiring process?
Absolutely.
Absolutely. Jess, what are your thoughts?
I couldn't agree more. And the timeline, it is challenging. And, when you put in the application, coordinating to get the interview set up, the interview to the offer can take a day or two sometimes. And that's if it's perfectly smooth. Then the process and the clearance and getting them to day one, we are often talking about a month. I'm not Gen Z and I don't have that much patience thinking about my new career and I'm ready to go and get started. So I don't blame anybody who's frustrated with that onboarding process before they even start for day one nursing orientation, new employee orientation to an organization. We've got to make it easy. It can't be easier to file your taxes online than it is to apply for a job. It's kind of extreme comparisons, but to Larry's point, I can upload almost everything on my phone. We should really look at our own internal technology to make that as smooth as possible and as efficient and let oh, gee, you missed a part right then in real time and not, well, how come I didn't hear back? These are generalizations, obviously, and a lot of companies have these struggles, but it's got to be easy. And I would say from the other side, the next generation, talking again with my daughter, she's not going into nursing, but a job you can quit day one. A career, you don't. Your career, you think about it a little bit further. But 2 weeks, even 2 weeks notice traditional, that's not enough on the other side that we want to make sure our patients are cared for. So if you give me 2 weeks notice, the reality is I may or may not be able to fill that position in the same way for sometimes a couple of months. And that's what the skilled experienced are in that same arena. That doesn't count transferring departments, a new specialty, or like our nurse residencies or internships. Those obviously take longer because we want to really have solidified skills and those fundamentals of that patient care before they expand. And unfortunately, that takes time, and it's the right investment for our nurses, but it does take time. So if we can't figure out where to be efficient somewhere, it's just going to continue to delay what we really need for the patient care in the communities.
Mm-hmm. Absolutely. And Gail, what are your thoughts?
I think as far as social media and recruitment is, people are, as both my colleagues mentioned, very tech savvy. So you can post on LinkedIn or Glassdoor your job opportunities. We all do that. Certainly that's the way to connect with people, that what options we have open for people to join. But people will look far beyond that if they're going to apply for a job. So it's not just what we list in that posting, it's what do our nurses say about where they work. And so they will go to blogs, they will go to platforms where nurses talk about their environment, where they work, what does staffing look like, how well do people feel cared for. And so all that investment in culture, doing the right thing, communicating, is all now part of that job posting. So, we want to encourage when people are telling their stories about, why they work somewhere, why they're a nurse. Those are as important. And certainly, we want to make sure that our reputation is strong. And if there are issues that we mitigate those issues so people feel that it's not just, an ad, that you're joining a team that works.
Mm-hmm. Absolutely. And Larry, you mentioned earlier, Gen Z, like you said, is one of the first generations to grow up with unlimited internet access and technology right at their fingertips and in their pocket. Um, obviously, virtual nursing and AI have become huge trends in the industry. So how can CNOs use technologies like AI and virtual nursing as selling points during the recruitment process? If Gail, you want to get us started.
Sure. So understanding the why of AI and virtual nursing is critical to using it for recruitment or even that it working well within your own workforce. So the goal here for AI and virtual nursing is to unburden the bedside nurses from doing tasks that somebody else can do so that they can care for patients. So looking at AI, for example, is we're now venturing into, which I have to smile when I say it, voice-activated charting for nursing. Of course, it's not there yet, but we are partnering to hopefully develop that. So if a nurse who now spends 60% of their time in the ICU, minimum 40% of the time in acute care, documenting into an electronic medical record typing, then that's not a good use of his or her time. And that can be, if we can do voice activated, wouldn't it be great if that time would then be spent taking care of their patient, caring, which is why they became a nurse. So that I think is really exciting. And then virtual nursing, a lot of organizations have invested in virtual nursing, and certainly here it's been incredibly successful. Our shift, it's never done though, as far as I can see. It won't be done for a long, long time because you have to keep shifting it so that the nurses at the bedside feel enough is done by virtual that they actually see them, that virtual nurse is part of their care team. If they don't feel like the virtual nurse is doing enough to shift a good portion of work, they won't feel that true benefit that we all want virtual nursing to accomplish. I just think that for both AI and virtual as bedside nurses and in it from the beginning, because we want it to happen with them, not to them. And then two is you have to keep at it. And it's really a lot of disruption that'll take place for a while, but really I think it'll make us much more ready for the future.
Absolutely. And Jess, what are your thoughts?
I had a colleague who referred to AI as augmented instead of artificial. And I thought that was so powerful for building that trust in the why we would use it. This is an augmented information towards our patient care. This is to help the bedside nurses, plan and stay ahead and look for opportunities that prevent those issues down the line. And we have a lot of variations of that already, and it's just expanding on that. An EKG is AI, if you really think about it. When it's predicting what kind of dysrhythmia this patient might be having, you might not diagnose from that AI, but it may guide your decision-making and communication style on that patient. And I think that we really have to build the trust, whether it's the virtual nursing or AI, is here's the solid why behind it and how it can help your role and help us make it as smooth as possible so that it isn't a burden, it isn't an added factor. I agree with Gail. It has to happen with our nurses, not to our nurses. And really even beyond our nursing, everybody understands how this benefits both them and the patients in their work life.
Absolutely. And Larry, what do you think?
Well, Gail and Jess hit, great points. I love augmented intelligence because that's exactly what it is. You have to have the voice of the nurse. You have to have them involved in the change or they're going to resist change. I think we've seen that across the nation. Whenever they were not involved or they did not have a seat at the table, they're more likely to rebel against that piece. So we have to bring them along this journey because, quite frankly, it is their journey. They should be the one that tells everyone how they need to augment their work. We need to do time studies because it's most important. And we we're reaching all those different generations that we spoke to. And I think each generation is going to come out with something differently from how they used to do it or how we should do it. And I think having that voice is the most powerful tool that we have whenever it comes to augmented intelligence for our nurses. And then, Gail, you and I briefly spoke about virtual nursing, virtual care with the work that Dr. Sarah Pletcher's doing there at Houston Methodist. I mean, you were the pavers of that. You've kind of, you pioneered that. And it's just how can we make that as a different, flexible option for the workforce to help retain them in the workforce by giving them a virtual option. It gives them a preceptor. I think in my mind, we can use that as preceptors. I wish that when I was at a new grad at the bedside, I could phone a friend and I would have an experienced nurse pop up on an iPad and walk me through a Foley insertion or walk me through a difficult IV or walk me through, hey, something just doesn't feel right. I have this gut feeling, and we can review some things together and provide that virtual care as a team, but also the goal would be to remove some of those, I would call them task items that are documenting things or something that can be done remotely, like med rec or discharge education, some of those things that don't require a hands-on piece. So I think augmented intelligence as well as virtual nursing is here to stay. It's how we embrace it. It's how we listen to the staff and how we act upon whatever their actions they tell us we need to do.
Absolutely. Thank you all for sharing your insights. I'm very lucky to have worked with Dr. Sarah Pletcher with her work on virtual nursing, and it's truly Houston Methodist is doing some amazingly innovative things in that field. So great shout out for sure. So I want to pivot a little bit to social media and what we've been talking about in that realm. So in terms of public outreach for nurse recruitment, according to the 2023 Gallup Honesty and Ethics poll, nursing does in fact remain the most trusted profession, with 78% of adults in the United States believing that nurses have high honesty and ethical standards. And this has rung true for about 22 years and counting, according to the American Nurses Association. However, that 70% or 78% is down 11 points from 2020, which to me could indicate a drop in public perception and trust in nursing. And of course, one factor could be the narratives about nursing found on social media, which nurses flock to, especially during the COVID-19 pandemic. So my question for you is, what role does social media play in nurse recruiting, and what potential does it have? If Jess, you want to get us started.
Sure. I really think about social media as such a big piece of your brand and your reputation. Mm-hmm. When we finish nursing school, generally we have a pretty good idea of where we want to go based on reputation of the different organizations. And being in greater Los Angeles area, we have a lot of options for their applications. They can go to many different hospitals, and we still want to be the one they choose. Mm-hmm. So you think about utilizing social media for that. What are we doing to continue that trust of the nursing profession? We often use it for recognition. The nurses that are receiving a DAISY award or have gone above and beyond and are demonstrating evidence-based practice are recognized by the patients or volunteering in the community, and really showing other nurses what our nurses represent here at Cedars-Sinai. We also utilize that in a way to demonstrate the inclusivity of our programs, and there's so many opportunities. And my daughter told, I want to see somebody who looks like me. I want, and that is a real thought, inclusivity across the board. And even if it's not race driven, it's cultural driven, it's financial demographic, social demographic. Are there people in this profession that I align with and I could partner with in my new career? So those are big ways that it influences applicants. So, to Larry's point, I would go on and look at social media. Now, the other spin is, if the social media is public on the individuals and you want to build trust, employers might scrutinize the social media that's out there of these individuals also. So it does work both ways, and people should be cautious about some of their public personas. We want to build our trust, we would hope that our employees would want to do the same with the community and their public, what's out there about themselves.
Absolutely. Yeah. Sometimes I feel like people forget that the internet is forever.
It's like sitting in your car. People can see you.
Exactly. Yes. Those
That's
windows
right.
go both ways. Yeah. So Larry, what are your thoughts?
No, Jess, you hit it, and I think y'all do an excellent job at doing like Daisy Awards. I follow you on like LinkedIn and everything there at Cedars. But I think the fundamental thing when it comes to social media is how do we build the trust, as well as how do we pique the interest of the audience, and we balance that piece. Because as you mentioned, you got to have the trust factor in there to get them to them, but then you also have to have them interested in your organization. How do I align? Jess, you mentioned some DEI efforts that are out there. That's huge with this generation that we're dealing with, and that's what they want, to make sure that they are included and inclusive whenever it comes to the organization that they ultimately choose. And I think that's the important thing that we have to remember, is they are choosing us. And it's how we come across as branded on social media, what we're doing from the strategy standpoint. But we have to stay ahead of today's social media factors in the digital age in order to continue to track new talent and retain new talent, because they're out there looking what is their potential next. So we have to continue that piece. And I think it's just the value, the attainability, what nurses are looking for, and what content that we can quickly get out there that they believe in, they trust in it, and then ultimately it's their decision to retain or either trust us as an organization.
Absolutely. And Gail, what do you think?
Yeah, Larry said it so well. That it has to have a strategy behind it. It's not going to just happen organically in social media. And really is, if we're going to have readiness for the future, what my colleagues tell me that look at this is that most people in high school already kind of narrow down what they want to do, which means as nursing leaders, we have to start talking to middle school people and appealing to them on social media and why nursing is a great profession, not just high schoolers, but all the way to middle school. So really in the media, unfortunately through COVID, of course, they saw nurses overworked, very afraid of getting COVID. And then they, since that time, there's been still, of course, media stories on burnout and then on shortages to come, not making it sound very appealing to be a nurse. And I think for those of us that are nurses, even though it's hard, I know for myself, I wouldn't have traded it for anything. I've had a great career as a nurse, as a bedside nurse, and as a leader. I wouldn't have done anything else. And so we really have to have the voices of our nurses talking about it. But our nurses and high schoolers and middle schoolers are smart. So you can't make it sound fluffy, because we're not fluffy people as nurses. We have to do really hard work. So we want testimonials that are honest, but really speak to the heart of why nursing is good and how this generation will be really helping us to shape the future of nursing. So you're not just taking care of a patient, you're really redesigning care in hospitals or in other environments that nurses are in. You know, if it's schools are going to need technology, if it's nursing homes, whatever it is, outpatient environments, nurses are everywhere. And to Larry's point, you do have that flexibility. You don't have to get stuck in one thing. You can have a long career as a nurse and do a multitude of things based on your life at the time or your interests. So really, we want to make sure as nurses, as nursing leaders, that we want people to know that it's hard, but it is an amazing profession.
Absolutely. And I like what you said about, it's people know what they want to do younger and younger every year, especially because of social media, and they can see the truth of industries, I think, a lot quicker. than in previous generations. So you're absolutely right. It has to start younger. So how do health systems in that case need to invest in their social media branding? And what does that look like? What are some tips or strategies that y'all have? If Larry, you want to get us started?
Yeah, happy to. I kind of alluded to it a little bit at first, at the beginning there with what Caitlin O'Brock's doing at SSM, but it's how do we put the nurses almost in the HR departments? I mean, I know that's a different thing. A lot of people are doing that. I've got a good friend, Nicole Dill. She's actually doing that over at Novant. So they're actually having, HR and having a nurse there whenever someone comes in and they want to speak to someone about a position. They immediately get to talk to a nurse. They begin the recruitment process, and they're able to shorten that time from hire down. So I think it's how can we influence them? Influencers are huge these days. I think nurses should be influencers as well too, and we should influence the next generation. We should empower the next generation, because we have to keep in mind that we keep alluding to that's what these individuals go out for. That's what they're seeking for. So that's what we have to meet them at in order to get them to come work for us at our organizations.
Mm-hmm. Absolutely. Jess, what are your thoughts?
I totally agree. But I want to go beyond just the next generation of nurses. We're influencing people who want to seek out treatment from our facilities also with our reputation and our cultures. And the patients also want to see people who look like them. So we really need to look at our communities and who our audience is so that they can influence the junior high kids and the high school kids. I was not going to go into nursing. It was somebody else who pointed out, I think this is a good fit for you. Maybe you should think about this. And this was before social media days. But social media could be used to influence those counselors at the colleges and the high schools, the community, the parents who have these kids are like, what do you want to do when you grow up? I don't know. And, these nurses are potentially our patients as well. Mm-hmm. So do we have that environment where they would want to receive treatment as well as provide it? We have to look at the whole picture, the whole community. It's not just nurses that we're looking to attract.
Absolutely. Yeah. And it goes back to that public perception thing, that the trust isn't just, I want to become a nurse. Should I do that? It's also, I, have a healthcare condition and I need to go get it treated. Where am I going to go to do that?
Or my family does, or my friend does, it's beyond. And why would I want to become a nurse? We can influence that with individuals. But we all know we're all influenced by more than just the others in that profession. So continuing to build our reputation as nursing so that others can recognize those in the community and say, hey, maybe this is a good fit for you. Maybe this is what you've been looking for.
Mm-hmm. Absolutely. And Gail, what do you think?
Yes, I think showcasing just the variety of options for nurses and also realizing that, us as nursing leaders too have to demonstrate and show that we're flexible too, so that people don't have to stay in the, we used to say, okay, you're required to stay, 2 years on your unit before you can move. Well, if it's the wrong unit, it seems pretty silly to make somebody stay there for them. So in offering options like, I'm going to be part-time virtual, part-time bedside, and I'm going to be flexible so somebody can go to school. And really sharing those testimonials that we don't just hire people to fill a slot, that we are invested in their career. And if it changes, we're okay. We have to take a deep breath and be okay, because we are in the business of taking care of patients. So every time somebody moves, it creates a gap and we have to train somebody new. But we have to look at the long run. And if a nurse can find where their talent and passion is best, then we've won. And that involves us being more flexible, but sharing testimonials of all the options in nursing, I think is a great way of doing that. And like we spoke about before, making sure that culture, what our institution is about, so people feel, again, that they're not just working at a job, that they've become part of something great, that will protect them, because there is a lot of violence that enters sometimes, unfortunately, our hospitals, and we have to have that zero tolerance that, again, their workforce is appropriate, that they're going to work with us to do innovative strategies to make it better.
Mm-hmm. Absolutely. So we've discussed plenty of strategies today, from recruiting with diversity, equity, and inclusion in mind to investing in social media and AI and technology. So how, to wrap it all together, how can CNOs gain departmental buy-in for a lot of these strategies? Obviously, we've got to make a case for ROI for a lot of these things. If Jess, you want to get us started.
Sure. I would say first, I want to touch a little bit on what Gail was saying about the movement of nurses. And that influences coming from our CNOs and our CNEs to our nurse leaders. It's not always a loss when somebody grows within your company. Celebrate that growth of those individuals and those opportunities. That can totally shift the culture on a unit. When you're talking about retention, I think retention's a fine line. Of course, we want to retain nurses as a whole. We don't want them to leave our profession. We don't want them to leave our organization, but we also don't want them unhappy in a position that's just not a good fit for them. Mm-hmm. So when we talk to our leaders about getting buy-in and departmental buy-in for some of these strategies, why is this important? The why on everything. I mean, we talk about it from every process improvement to projects and, changing our platforms on social media and even just changing HR platforms. That's not uncommon as, systems grow, or documentation platforms. Why is this beneficial? And we all have to be aligned on that from the beginning about why we're doing something and how this benefits our workforce. That definitely shifts the focus. And then really celebrating the growth of those individuals. As Gail and Larry both mentioned, not everything's a good fit for every individual. It doesn't mean the nursing profession isn't, mm-hmm. but if we can help them grow and celebrate them, we can retain them with the organization and supporting our communities for much longer and find that pathway and what that healthy balance is.
Absolutely. And then Larry, what do you think?
Yeah, I mean, to get the buy-in, that's always tricky, right? But I think we hit a lot of them during our talk already, but it's, proving your impact. I think the CNOs have to prove their impact. They have to listen to the nurses, have the nurses at the seat of the table. And just as you mentioned in Gail, it's okay if someone moves on sometimes. That's going to even get you more buy-in from other individuals because there's so many different things that we can do in our profession. So definitely listen to them. But I think the most impactful thing is technology. I'm a firm believer that healthcare is always about 5 to 10 years behind any other industry when it comes to technology. We have to embrace technology. We have to use technology to our advantage. If it's within staffing, if it's with basing, your acuity, but technology has to be more efficient. It has to be part of the nurse's work, part of how they've helped describe it, how they've helped do their workflow. And if an organization does not have their own branded app to manage their internal resource pool or anything to see holistically within the next year or two, I think they're really going to be behind the bar because an application is for everything. That's what they're used to living off of. We order food off our apps. We order rides off of our apps. We do everything off of our apps. Mm-hmm. And if the healthcare organizations don't have an app that's branded for them, I think they're really missing the ball in the future.
Absolutely. And then Gail, what are your thoughts?
Yes, certainly it's an investment. So recruitment of nurses, it's a big investment by an organization, and certainly innovation is a huge investment. So I think for CNOs, we have to talk about to everybody the why, and we have to partner. So I have to have a strong relationship, not only with Dr. Pletcher, but also the IT department in order that they work alongside me to ensure that we can tweak and hear the voice of the nurses. That relationship is critical. And also partnering with ancillary people, because technology is going to work also for pharmacy to do med reconciliation, case management, in order that they can get patients prepared for discharge. For nurses, we're used to a team sport. We don't, we are always advocating for our patients, working with others. And so we're probably out in front a little bit in nursing to use, just different virtual environments in order to provide care. But we also have to talk about what's good about them, what works, and so we can share that others can do the same. You talked about, G, in the beginning, there's going to be a shortage of nurses. And we also know is that nurses have had concerns with burnout and the appropriate workload. So the two together is our why. Mm-hmm. It's our profession. It's what we are the ones taking care of the patients as nurses in our particular part of the healthcare team. So we have to not, hide from it or be afraid of it. We have to now try things that keep going and really share. So we don't just have one component of care ready for the future, but if there's shortages in other ancillary or physician environments, that they're ready to. I think that'll help everyone.
Absolutely. Well, thank you all once again for this excellent discussion. We're now going to move into the Q&A portion of the program. So we would now like to invite you in our audience to ask live questions of our panelists. As a reminder, if you're participating in the live program, to submit a question, click on the Q&A widget at the bottom of your screen. It might already be open and appear on the left side of your screen. Please note that your questions will remain anonymous and will not be viewed by other audience members. So it looks like we've got one coming in here. How does the panel feel about using social media to influence positive impressions through meaningful, inspirational posts on personal pages? If Gail, you want to start this one.
Sure. I think Jess talked about it a little bit is we want to make sure our patients are protected. So not posting pictures or patient information is critical, that somebody can't figure out who is in our environment. So that's usually our worry as nursing leaders that happens. But hearing from a nurse what their why is, why they feel like their talents and their passions are utilized in whatever environment they are a nurse, certainly is much better than me speaking about it, because it really hits to the heart of nursing. And nursing is that art and science. So we are very analytical about the care we provide, whatever environment. But we also carry our caring part, the listening, the attention to our patients in all environments. That's who we are. So hearing that from the voice of a nurse is, I think, really helps us to be stronger and recruit more.
Absolutely. Jess, do you have any thoughts to add?
I think Gail covered most of it. We fought to be at the table. We have to use our voices for good. And just remember that the window, we can see both ways through that window. So just be cautious. But it's great. It's great to see nurses advocating for nursing and sharing the positive aspects of it. And I even don't really disagree with sharing some of the not so positive aspects of our career. It's a very physical job, and especially at the bedside, it's a very mental job. You have to think about things all the time. How do we partner with our physicians? How do we partner with our ancillary teams or support teams? How do we not undo each other's work and make sure that we're all driving towards the same goal? We just have to take all aspects of it into consideration and really reflect on our own practices and what we put out there for our reputation as nursing in general.
Mm-hmm. Absolutely. And Larry, do you have anything to add?
I agree with what both of them, and I would actually encourage it to be on their personal pages as long as they meet the requirements, as Gail elegantly stated, from PHI and HIPAA and all those good things. Because what I've seen and what I've learned, especially being in the on-demand space, the word of mouth is the strongest recruitment tool that we have. And if you can tell the individuals good things, even bad things or real things, I think that's going to be a very strong recruitment tool for you when it comes to social media platforms.
Absolutely. So we've got a few more questions coming in. Here's one. Are you thinking about additional changes to models of care in addition to virtual care nursing? And do you think this will impact recruitment of the future? If Larry, you want to get us started.
Yeah, I think the one thing we probably didn't touch on will probably be hospital at home. I think that's going to be, it's going to be huge. There's a lot of programs out there. There's a lot of people that are paving the way with that piece of it. So I think outside of just the virtual nursing, you can put hospital at home. How do we keep these individuals in their environment where we also provide them the adequate care that they need, either virtual or hands-on? So mine would be just the hospital at home environment.
Mm-hmm. Absolutely. Gail, what do you think?
Yes, I think that utilization of technology to be able to see if a patient is improving or deteriorating, that starts in the hospital and then, as Larry mentioned, goes with them all the way home, so that we look at trended data and can see if a patient is improving or not. To help support that bedside nurse is certainly another area that we are exploring here, in order, again, to be extra armed so the nurse isn't needing to keep going back into the record, that they have extra support in order to do that.
Mm-hmm. Absolutely. And Jess, do you have anything to add?
I think nothing's off the table. Talking about, like Larry mentioning the apps, how can we utilize what we do in our everyday life in a way in the workplace just to make life easier? And I think when we talk about technology and expanding and how do we support our communities and our staff, that ease of use has got to be at the forefront of everybody's mind. Don't undo other people's work because it was easy for them doesn't mean it was easy for the other teammate. And really look at like the bigger picture, even from, and I'm going to date myself, when we first went to electronic health records, it seemed like downtime and charting on paper was much more frequent than it is now. And with each generation using less and less of those older workflows and documenting on paper and having to remember two different processes, you almost can't afford to have downtime. We have generations who've never had to document on pen and paper. And they're thinking, what does that documentation look like? What do I put on paper versus what do I put in the computer? I'll just wait. Well, then we have to be efficient in our workflows to make sure that if the system goes down, how quickly can we get it back up to support their work needs? It's challenging. And each generation and each culture and everybody, how do we make it equitable and inclusive so that it's work that we can all do together?
Absolutely. So to continue on this technology train for just a second here, we have another question that says technology is important and is continuing to expand at a rapid rate. For all of the virtual strategies, do you have a manager for this role, or do you have it, or do you have a role under a leader that has existing responsibilities such as quality? If Gail, you want to take this one first.
Sure. We have a leadership team over technology. We have several components now to virtual. So we have virtual sitting for patients that don't require a sitter right there. And then we have virtual nursing. We're starting a virtual hospitalist program. So it started small as a small leadership team and has grown as the technology has become more and more part of our care.
Absolutely. And what are your thoughts, Jess?
I would say we have kind of a hybrid model, and it will be dependent on every organization's size. Larger facilities may have the resources to have different layers of individuals responsible for things. I mentioned that we are a smaller facility under Cedars. So while we might have an individual who oversees a team, we would involve our staff. We might have nurses that give influence how this will work. Right now, we are in the midst of all kinds of new technology coming for a brand new building. Everything from the voice dictation model for nursing to charting on a touch screen on a wall for the quick, easy things to keep our CNAs moving more efficiently. But that's great if I can do it, but I'm not there doing the work. So we want to bring in those voices. We use our shared and professional governance models and look at different options, and they bring a lot of great ideas forward. We have super users for our electronic health records. does this make sense at the bedside? I can think what the logic was for me when I was at the bedside, but that may not be as relevant to the individuals working at the bedside today. So there's lots of options and lots of ways to expand and look at all kinds of different things. We just can't lose the voice of the person actually doing the work.
Mm-hmm. Absolutely. And then we're coming up on time here. So Larry, do you have any last minute thoughts?
I think Gail and Jess hit it. I think just listening to the voice of the customer is the huge thing. So I would end it with that one.
Absolutely. Well, unfortunately, that's all the time we have for questions today. In closing, please note that next week's program will cover the winning edge for lowering labor costs. A live clickable link will appear at the close of this program, taking you to our registration page for the next event. Remember to follow along all week as we cover the topic of recruiting the best nurses on our website, healthleadersmedia.com. And with that, I want to thank our panelists once again for this excellent discussion. Thank you so much for your insights. And to our sponsor, CareRev, huge thank you as well. And finally, thank you in our audience for participating. We hope you enjoyed today's program, and we look forward to seeing you during next week's program on lowering labor costs. Thanks so much, everyone.